I'd like to introduce Steph, who's going to talk about what we do to support care home research, both during the last year, but also the plans for the future. So Steph Green's the ENRICH Cymru coordinator, and she'll tell us all about that. Thanks, Steph.
Okay, yeah, thanks very much, Nikki. And that was really interesting, Felicity, as well. I would really like to be part of the media training. Have been approached by Wales Online during the pandemic, and it can seem a bit daunting if you've not had that training. So I'd be quite interested in that. So yeah, I'm Steph, and I coordinate the ENRICH Cymru care home network across Wales. And I'm really pleased to say that we've had additional funding within the last year from Welsh Government to continue this work into the future, which, as we all know, is extremely important to be supporting care homes through research. And the network is a joint collaboration between CADA, which is the Centre for Ageing and Dementia Research, funded by Health and Care Research Wales, and also with the Support and Delivery Centre. So I've been working very closely with Helen Grindle, the head of Support and Delivery Centre, during this last 12 months to build on the work that ENRICH has already been doing in Wales, and to grow the network further. So I'm really happy to be talking to you all this morning about how we've been supporting the care home community through this pandemic and beyond. So let's see if my clicker works. Brilliant. So I thought it'd be useful to give, first of all, a summary of the development of how the network grew in Wales to set the scene, really, and to talk through some of the both the opportunities and the challenges, because there have been both during this pandemic for care homes, and then really to focus on some of the future opportunities and how we'll be developing. So I'll talk about the new funding and the new team, and how we've been working closely with the Support and Delivery Centre, and comms has been quite a key part in that, because obviously the timing and the tone of the message has been very important. So I thought I'd start by just really breaking it down for those who aren't familiar with the ENRICH network. The acronym stands for Enabling Research in Care Homes. And that network has existed regionally across England for about 8 years. And there's a very new network in Scotland as well. And in Wales, at the beginning of 2017, there was a national conversation about whether we might need ENRICH in Wales. And this was led by the Wales School for Social Care Research, as it was then, through a consultation exercise with care home managers and other health and social care practitioners, as well as academics and researchers. And it was a resounding yes that they felt that ENRICH was needed in Wales, but that really it should be focused on the needs of care homes. So really holding the care home voice as front and central in this network. And so that's the spirit which I've tried to carry through as I started in post at the end of 2017 and developed it here in Wales. And we've had really quite a unique opportunity in Wales, because I could draw the learning from how developments happened in England and then develop it as fit for purpose in Wales. And I did this by working really closely with care homes from day one. So running focus groups with care home managers to test out new ideas and resources and sort of check the language was right. So by doing this process, it's been very much a collaborative, as Felicity was talking about, this idea of collaboration and two-way partnerships with care homes has been very important all the way through. And I think even more so probably during the pandemic, when care homes are so stretched for time, it's really got to be a beneficial two-way partnership. And I'll explain a bit more about how that's been happening. So like I said, it's all about Enriching Wales is all about building a relational approach and building up these longer term relationships, which thankfully we can now do with this extra funding, so that we're not just a fly in the night, here one day, gone the next kind of entity. We're saying that we're here for care homes and we'd like to build these relationships, and we're listening to their priorities, as well as offering the opportunities which are already available. So I'll talk a bit more about specifically, the COVID research trials. So it's really that balanced approach of saying, what are your priorities? How can we work with you? And also, we have some opportunities for you as well. So it's that dual approach, if you like. And this approach is well founded in research. So there is research to say that a research network that's built on longer term relationships is more successful and it's more sustainable. So we're using the evidence really to build up this network. And during the last year, myself and colleagues wrote a paper about how we best do this, and especially during a pandemic. And that paper's been published and it's still open access. We've also written a blog, which has been tweeted with the support of the Health and Care Research Trials Comms team. So I'm sure we can send out that tweet again, or sort of send you the link as well to that paper. Okay, so like I said, the voice of care homes in developing research is really important, and I'm sure lots of you on this conference will already appreciate why we bother to co-produce research. But I really wanted to recap because it's actually even more important in this context of the pandemic, so that the most relevant questions and issues to the care home community are explored. So we're not going off on a tangent and looking at questions which aren't directly relevant. And most importantly, and it does seem quite obvious, but I'll explain a bit more about what I mean, that participants are included and able to understand things like the study resources. So I'll talk a bit more about the principal trial as we go on, but it's an example of a study where, because they limited the eligibility criteria, about 75% of the care home population were excluded, which therefore makes the results less useful because those people haven't been included. I'm really, really pleased to say that they have widened the criteria, and there'll be some work to do now with the comms team around how we communicate that message to care homes, to say that all participants, whether they have current mental capacity to consent or not, will be able to be considered to be included in the principal study, which is offering different treatments for older people who might have COVID. So, including the voice of care homes throughout designing research is really important for the end result, that the study is useful for the population. Sorry, just get back, and that the most appropriate methods and measures are selected, and there's work going on at the moment about the core outcome data set that we need in these trials. What are the most appropriate methods and measures? And it's Dr. Vicky Shepherd in Cardiff Trials Unit who's leading on that study. Okay, so focusing now a bit more on both the challenges and the opportunities during this pandemic, because there have been both. But overwhelmingly, I'd say that care homes started off on a real back foot in terms of opportunities for care homes to be part of research, because they weren't even part of the original sleeping suite of documents, the ISARIC protocol. They weren't in there, and there was no representative on the SAGE research group. So they did start off on the back foot, and so progress was much slower than within acute hospital healthcare settings. But we then had the principal trial, which opened up and after a few months into the pandemic. So that's a platform randomized trial where participants over the age of 50 and including in care homes could take part in the trial, which offered different treatments for if you've already caught COVID. And that trial is still ongoing. And like I said, it's now open for all residents in care homes. whether they've got capacity to consent or not, and that is assisted by a consent process with a family member or a loved one. So that's been a very important study, and there's obviously been challenges within that study as well. So and then we've had more recently the PROTECT trial, which is looking at preventative measures to sort of prevent the transmission or the severity of symptoms of COVID, and that's opened recently, and that's still in its setup. So both those trials are funded by the NIHR, and we've been working with the Health and Care Research World Comms team to make sure we've got a coordinated approach with the NIHR when press releases come out, and it's unfortunate in some ways. They both start with PR because they might get easily confused. So there's some work to do around defining and making care homes aware which trial is for which, exactly which type of intervention. So there are some important questions from the pandemic, and this was already happening pre-pandemic anyway, is who's setting the research agenda, and how can care homes contribute to that agenda? And that's one of the focuses of the ENRICH Cymru network going forward, is how can we ensure that care homes are listened to? And I wanted to draw on Helena Herklot's, the Older People's Commissioner's report that she published, because I absolutely love the phrase experts by experience. And I think, you know, we all have our own value to bring in our different work areas, but I can't claim that I'm in a care home every day and know the day-to-day challenges. It's the care home staff, care home community who are the experts by experience, and they have to be provided with opportunities to share their views, to make sure that the things that matter most to them are properly understood and that they're shaping care home policy on a national and local level. And I've got the link to this report at the end of the presentation if you want to delve a bit deeper, but it was a really good piece of work that the OPC office did around making sure that the stories of the care home community are listened to. So there's quite a number of case studies after their engagement events that they report in that publication. Okay, so the role of ENRICH Cymru has been quite evolving during the pandemic, because the first part of the pandemic, I was myself and Helen were applying for more funding to support ENRICH going forward, so that took up a lot of my 6 hours a week. But I'm so glad to say that that was successful. Alongside that, I did take quite a big advocacy role to try and inform some of the research which was in development. So lobbying the Oxford principal trial team to ensure that residents without capacity in care homes were included, and tasks such as that. I did a lot of sense checking through the network. So if any resources were sent my way or I saw them online, I would send them out via the network to check with managers. Are these useful? Would you use them? Would you change them? And obviously managers are very strapped for time, but I would always offer the opportunity for them to contribute and have their voice. So there was a top tips document that was developed in England through the NIHR, and that's had a few iterations with care home managers' input. It's actually called Top Tips for Tricky Times, so that's quite a tongue twister, and that was quite difficult to develop because you know, the research that they drew on, a lot of it came from hospital and acute settings, but it does seem to be quite a useful document now that it's had that care home voice within it. Obviously supporting new research, so it's very much been like waiting for a bus to come along. So many new funding applications have come my way during the pandemic, and each and every one I've put out to the ENRICH Cymru network for care home managers' input, just to make sure that the methods and the measures that teams are suggesting are appropriate. and like Felicity was saying, communicating the value of the role of research. So I spent quite a lot of time writing the call to action paper that I talked about earlier, that really highlights the value of research in our way out of this pandemic. And while there's a lot of work to do getting research up the agenda of NHS boards, there's a lot more work to do in social care, and especially in care homes, to communicate the value of research and to say, research is for you. This is something that you can and should be involved in, and how we best support that with care home staff. And I'll talk a bit more about the plans for that as we go through. But like Felicity was saying, it's really now about hooking on to this idea of research improving lives and being for everyone and touching everyone's lives. I think we've got a really good foundation there to build on that message, and to sort of and for care homes to rebrand it, to say it's not about doctors in white coats. It's research is for everyone, and we want to hear your ideas for research. We're not just going to be chucking opportunities at you. We want to know what your priorities are. And obviously cascading information about new and developing studies. So as best I could last year, I did a semi-regular newsletter out to the network of homes we have, which by the way is 22 homes as it stands in Wales, but that number will be growing now I've got the new team in place. I've also been doing this via Twitter, and we've just got a new Facebook page as well. So that's another way we've been able to cascade information, as well as through the Health and Care Research Wales regular bulletin and the website. I must say that the ENRICH Cymru Network website page is now within Health and Care Research Wales. And we can also cascade, we've also been cascading information via the CADA networks and the Centre for Innovative Ageing, which is in Swansea University. So we've got quite a number of avenues which we can cascade information. So it'd be really good to keep working collaboratively with the comms team to build upon those avenues as well. So I just thought I'd talk then about some of the ways in which we're supporting care homes to develop their research priorities. So one of our newer care homes in North Wales, Llangollen, have been working on a number of projects. So they've written a new book about lockdown legends. So they had a local author come and speak to the care home residents about their stories during lockdown, and that's going to be published and shared. We're also part of a COVID collective with this care home, and they're linked up with their health board and the council. And that's really about supporting how they best support care homes in the community to rise up from lockdown. The project is actually called Rise Up from Lockdown, and they've got good links with their social prescribing networks up in North Wales as well. So at the moment that's being developed for a bigger project with funding, all under the guise of prescribing for health. So as part of a wellbeing hub, and that's come from the grassroots. That's come from care homes and community. So this is an example of one of the ways in which we're, as well as promoting the NIHR very important trials, we're also supporting the development of new research which is born from care homes themselves. So very excitingly, I can introduce the new team that we have now working with the ENRICH network in Wales. They've been in post for about 2 months. So Sondra on the left is based up in North Wales, which has worked out absolutely perfectly because Emma on the right is based in South Wales. So they job share 50% each. And they've already been a huge asset to supporting the work of ENRICH in Wales. Sondra takes a lead on the principal Protect study, and Emma takes a lead on the principal study. So they'll be working closely together along with myself and Helen and the rest of the support and delivery centre, as well as CADA. So the ENRICH family is growing, and within that we can definitely grow the ENRICH network and get the message out now that ENRICH is alive and kicking in Wales and very much expanding. So yeah, just to finish on then some of the future plans, and I do really see this as a time for change. As we all know, care homes have risen so rapidly up the political agenda, and that's been the same as well for research, the research agenda. And I really want to make the most of this time now that that we have to build on what's gone before, and to steer the network into the future. And that has already been started to be shaped by the newly formed ENRICH Cymru advisory group. And we have a really fantastic mix of representatives on that group, from care home managers, members of the public, academics, and other health and social care practitioners, Social Care Wales. And apologies if I've forgotten anyone else, but it's a really, really brilliant mix of people in that space who will help to support and steer the work of ENRICH forwards. So then, as I mentioned, other opportunities to co-create research, like the Rise Up from Lockdown project, will be happening, and we'll be running seminars, possibly through the Teams channel. We're just testing out new ways of engaging with care homes and what might be the most accessible and the way in which it can be the least burdensome for care homes, because we know they're time stretched. We're looking at, so we've got one blog published now about the research paper which I mentioned, and we're looking at other accessible ways to engage with care homes. So it'd be really useful to be working with the comms team around that as well, how we can do maybe bite-sized bulletins or something that's just quick and easy to digest, really. We'll be running a series of seminars on some of the hot topics in research, and from what we can gather, one of the hottest topics at the moment is about care home visits. So we're going to be hosting a seminar in July, if not before. We hope to do it sooner, but at the moment we've set the date for July to draw on some of the evidence, which is international evidence for how we can best support care home visits in a creative way in the UK. And like I mentioned, yeah, the team, we've just set up a Teams channel for care homes to increase their engagement, and that also has within it the application form which managers would need to express an interest in joining. And we feel it's much more accessible and a quicker, easier way to express your interests. So we've got lots of plans in the pipelines to support care homes going forwards, and really appreciated this time today to tell you all about how things have been developing. Just to say, there's a few links there that I've talked through in this presentation. Please do follow us on Twitter @ENRICH Cymru, and please do drop me an email. I try to just work on a Wednesday, but I can also pass your emails along to the new team members, which is fantastic. So that's all from me, Nikki, and I'd be really happy to take any questions.
Thank you so much, Steph. And in fact, there are quite a lot of questions, so I'll try and group them a little bit. The first sort of set of questions are about the response that you got when you first approach a care home. So what, are staff aware of research, or are you starting from a really basic level? Are they enthusiastic about participating or getting involved? What sort of response are you getting?
Yeah, that's a really good question. And it reflects, I think, the diversity of care homes in Wales. So I think probably the first few homes that joined were already kind of research savvy, or at least they'd been part of maybe one or maybe two studies before. So they might have already had a taste of research, and that's inspire them to be part of the ENRICH network. So you have that kind of home. You have homes that are really are standoffish and think, oh, it's not for us. But it's really useful. When we were allowed, every home I joined, I went to the care home and talked to them face to face and built that relationship and explained that research isn't scary and it's for everyone. And started to break down the barriers. And very importantly, that, like I mentioned in the presentation, that every single resident should be eligible to be offered the opportunity to take part in research, because some managers will just completely dismiss them and say they don't have capacity, that they're out. But through talking with the manager and staff about, actually, no, that is possible. We've also developed takeaway leaflets to leave in the care home with a flow chart to say what happens if the resident isn't able to give consent at this moment, and to guide them through, so that when I'm not there and they think, oh, this study has come up, what about this person, they can follow it through. So so there's that side of it. Some homes are really interested in using research as a tool for promotion, so it can look good on their website or prospective new residents. Some love having a certificate on the wall. So it does vary a lot between homes, but I think the pandemic has hopefully shown that research is a very important tool in improving the lives of the caring community. So yeah, I'm hoping that this is a real moment for change, and that if we can hook onto that message, it's going to make it a lot easier for those homes who may have been reluctant before to consider taking part in research.
And you mentioned a few of the barriers there. And you mentioned that some initial conversations, people have been concerned about certain things. What are one of the other questions was, what are the barriers that you're experiencing people perceive to be the case, even if you're then able to reassure them?
Yeah, I think I spoke about some, and I guess also training for care home staff. Probably one of the barriers, and it's one we talked about in the advisory group, that the care home staff don't often get that chance to upskill and learn more about research, because, and I think if that was built upon, and we can create a culture of research, then it would be talked about more, and it would become, it would come into the language of care homes more so than it is nowadays. I think it's very much separate. It's something else that happens somewhere else. But if we're able to upskill and sort of train the social care workforce, especially in care homes, which we're looking to do now, I think that will help.
Yeah, and Jane Goodwin makes a comment about that training. What's the plans for training people in the sort of basic recruitment, study facilitation, or qualitative research skills?
Yeah, I mean, we haven't got solid plans, but I do have a set of training slides that we developed with the Support and Delivery Centre before the pandemic. But I would be keen, before that's rolled out, to actually go to the ENRICH Cymru network and ask for their priorities. What would you like to see in the training? That's very much in the spirit of ENRICH. But whether we could have, a number of different training opportunities, which might suit different staff at different times, but obviously that there should be one which covers the basics, I suppose, and then you could build on it and have different opportunities from there.
And you talked also about the capacity, so people are concerned about the time, I guess, to do research, or as well as having the skills. So what's the plans to increase or develop that delivery support, the hands-on work to do the study tasks, that's not just dependent on the care home staff to do, perhaps?
Yeah, I think for the bigger trials that comes from their setup, and I know with the Protect trial they have built-in capacity to fund care home staff and even have a champion within the study. because it does very much depend from study to study, I suppose, what kind of support is needed. For some, smaller PhD or smaller studies, that there might not be very much burden on the homes, and that's very much the idea that we want to impress from ENRICH, is that make it as light touch as possible. But obviously for some of these bigger trials there is delivery support very much needed, and obviously it's so much more complicated with COVID that it's not always possible to go and support, but there is a lot you can do virtually, and I'm sure with the Protect trial they've got tablets and things that they are going to be supporting homes with. Yeah.
Great. Well, thanks very much, Steph. And it's great to hear of the developments that are available. I know sitting on the Urgent Public Health panel, we've been pressing the capability in Wales to also participate in some of the studies that have been operating in care homes, and looking forward to working with you closely next year, for the rest of this year, in terms of trying to increase that activity as well. So